I'm the clinical lead at Helping Minds, and in the next half an hour or a little more than that, I will tell you about our experiences and our program for treating skin picking and hair pulling. So first, just let me give you a brief introduction. So first, who we are. So we have two platforms. They're based on similar programs, and they're meant to treat either skin picking or hair pulling, or if you struggle with both, you can practically use either of these two platforms. Our programs are based on empirically validated systems of treatment, so based on principles of CBT, and they're usually meant for adults. We tend to accept younger clients if they're 16 or over, but not younger than that. Before I show you what our treatment looks like, I would like to give you a piece of news for those of you that may know about us, which is that we're creating a program for parents as well. It will be based on the same principles that our standard programs are based on, with the exception that in this program, we will be helping parents help their children. So the programs will start, they should be active by April 22nd. So keep that in mind in case you feel like this might be useful for you. The reason why we created this is because in the past few years, more and more people have been, more and more parents have been writing to us and asking if we have something to offer their children in case they're not old enough to actually participate in our programs. So I'm going to tell you a little bit about how we work, how we structure treatment, and what are the treatment outcomes that we usually get. Overall, we can say that treatments at Helping Minds have 3 steps. Each step builds on the previous one and, let's say, goes deeper than the previous one. So we start all our treatments by introducing habit reversal training, which is a simple behavioral intervention which allows you to gain control over picking or pulling and then also minimize the damage that you do. We then build on this by kind of using principles of acceptance and commitment therapy, which is another type of treatment that has been shown to be very effective for BFRBs. And then once we complete both steps, we move on to work in a slightly different way, which is something that we call the deep dive, which is where we actually dwell into the psychology that kind of underpins skin picking or hair pulling. So our program has a structure, but this structure is very flexible. So habit reversal follows a certain pattern. Acceptance and commitment therapy has its techniques and principles that need to be implemented, but they are flexible enough so that we can adjust the program for every individual client. But then when you reach step 3, the entire program is completely customized. We have something called the catalog of sessions, and then we assemble an individualized program for every individual client. Because everyone's needs, reasons, and problems that kind of underpin skin picking or hair pulling are different, then we create a custom-made program so that you can specifically work on something that will be efficient and practical for you. So in the next few minutes, I will show you how the program works by kind of showing you how one client travels through the whole process. If you plan on starting therapy, either with us or anywhere else, you will find bits and pieces of information here that will help you set realistic expectations. For me, this is a very, very important thing, and it's something that I've started addressing in the very beginning of treatment, because I've noticed that once clients come in, they have a set of ideas about how therapy should work or what kind of progress they should be making, or essentially anything where you can put in a should, they have it. And this really impacts how treatment usually works. And very rarely is that for the better. So keep an eye on those parts. So let's see who our client is. So this is not an actual case report. This is let's say, a collection of clients and concerns that I see frequently. But I named this collection Maggie. So we can say that Maggie is 27 years old and that she has struggled with BFRBs since she was 14. So over the years, she tried stopping in different ways, but she would somehow always relapse. She tried seeking out treatment, but it was difficult to find a therapist, and also with so much shame and stigma that kind of tends to go along, she really never did. she found our program and realized that it's a program that's done in writing and that it's completely anonymous. So she was encouraged by that to try. This is actually a very common story, and a lot of our clients find our program and really enjoy the anonymity of it. We don't save your data, we don't sell your data, we don't use any, basically the only thing that your therapist will know about you is what you choose to share, which doesn't even have to include your name. So it's a place where you can basically share whatever you like without any fear of judgment or negative feedback. So what happens? Maggie decides to start therapy. She goes to one of the websites, she registers, pays, she fills out 2 forms. These forms will give her future therapist some general information, and so that they know where to start the treatment. Once she submits the forms, she's assigned to a therapist. She learns who her therapist is, how they work, what kind of experience they have, and the therapist gets to learn about Maggie as well. Let's say for practical purposes that I'm the therapist that's assigned to her. It can be really anyone who works with us, and anyone who works with us really knows what they're doing. So we don't have therapists that don't know how to treat BFRBs. But let's say it's me for our story here. What I usually do is that I start to get to know, obviously, the person, and then I start to get to know the problem. So usually what we do in the beginning is we trace Maggie's entire history with BFRBs. Let's say it's skin picking, so to make things simpler. So what I do is I examine how skin picking started, and then Maggie tells me the whole story up to present day. As we start habit reversal training, we always focus on what triggers picking or pulling in their current life. But having this historical perspective is quite beneficial. And I think it's sort of a neglected art to chart one's history with a problem, because by looking at the history, we don't have to look at every individual tree. We can take a look at the whole forest. That means that certain patterns, which might be invisible in day-to-day life, will slowly emerge. And this doesn't just mean the triggers or sort of the problems behind skin picking or hair pulling. This also means your strengths and your capacities. Someone who has been struggling with BFRBs for 13 years, like Maggie in our story here, likely has had periods when it was more intense or less intense. Sometimes they intentionally manage to stop for a while. Sometimes the urges simply subside for apparently mysterious reasons. When we take a look at it historically, we can actually recognize what was it about her life or her capacities that allowed her to stop. So we learn a lot about a person's strength from the way they coped with events in the past. Then, once we get to know the problem on that, let's say, historical scale, we kind of dwell into her everyday life. We start habit reversal training. The way that we implement habit reversal has 3 parts. First, there's the awareness training, then there's data analysis, and then there are the competing responses, which are the techniques that you actually implement in your everyday life. Right at the start of the treatment, Maggie starts to have her own doubts. She wants to skip awareness training. Her therapist, me, being annoying, says, no, you can't skip parts of the treatment. She says, but no, I'm very self-aware, I'm very introspective. I've struggled with this for so long, like what is there to discover that I don't already know? So I explain 2 things. One, we do awareness training because you have to be aware of picking or pulling as it happens or as it is about to happen, because the only way to apply a technique to stop something is if you know that it is happening, right? So you have to have this kind of acute moment-to-moment awareness. And then the second thing is that this is how we learn and gather data. When we have, let's say, a period of 1, 2, or 3 weeks of self-monitoring, we can look at the information and patterns will start emerging. Patterns that get lost in everyday life and patterns that certainly we miss no matter how introspective or smart or self-aware we are. Maggie says she doesn't need that. So I ask her 2 simple questions. Just before you start picking, what do you feel? She says nothing. I say, well, what do you think about? Or, what goes on in your mind? And she says nothing. So then I ask, is it logical that nothing happens? Like our brains create something around 60,000 thoughts every day, but conveniently every time that you're about to pick, there are none. I mean, does that seem logical? She agrees that it doesn't seem, and then agrees to do the awareness training, but she's very reluctant. And this is obviously a fictional story, but it resembles a lot of the stories that I hear. Clients will come in and then they will be very apprehensive about actually monitoring their behavior, right? So Maggie's reluctance to fully commit to self-monitoring or awareness training in general led to her having to do the habit reversal part a little longer, because she would try to progress to do competing responses, but because she didn't have enough data, she wasn't able to actually select functional techniques, right? So she wasn't really very committed because she didn't trust the program. It didn't seem to match what she imagined the program should be. Because she didn't trust the process, she wasn't really very willing to engage with it. If she wasn't very willing to engage, meant that she was also not very likely to be successful. So when then you fail, failure weakens trust, trust weakens your investment, and then essentially that's where the downfall could potentially begin. This is why whenever I encounter resistance or reluctance or anger, that's an issue that I really like to elaborate and talk about. As you will see, Maggie's resistance to treatment will probably give us the most useful insights. As an addition to competing responses, we implement additional techniques that we call stimulus control. Stimulus control is essentially a series of interventions in your environment or on you that will prevent urges from arising, or that will prevent you from picking or pulling once you... I'm talking mainly about automatic aspects of it now. So, for example, wearing gloves would be a stimulus control technique that usually works very well, but that clients are very often ambivalent about and don't like to try. But then, for example, if you touch your face or touch hairs while wearing gloves, you're very likely you won't be able to differentiate. For example, if you pull coarse hairs or thicker hairs or something of the sorts, gloves will make it impossible to differentiate between them. So that would be, and then the urge might not arise. That would be an example of stimulus control. Whatever I propose, Maggie kind of rejects. She says, well, that's really silly. It doesn't really work. It's too simple. It's too ordinary. It doesn't look very scientific. It doesn't look very profound. In addition to this, every time that her competing responses wouldn't work, she would declare herself, therapy, and everything else to be a complete failure. And here we kind of see certain themes that already are repeating themselves. There's a lot of black and white thinking going on. And then also Maggie sets incredibly high expectations for herself. For example, she will say something like, well, what's the point of a competing response if it works 7 times out of 10? I will point out that 7 times out of 10 is really very good. She will say, well, you can make the case that it's good, or you can say that it failed 3 times. So we talk about what progress means for Maggie and what change means for her. And we come to this expectation that she will either stop immediately or she failed. There's nothing in between. There's no gray, right? She wants change, she wants it here, and she wants it immediately. Psychotherapy, needless to say, is not a miracle cure or a magical pill. So it doesn't work that way quite. It seems simple. Like when I described in the beginning the 3 steps, habit reversal, acceptance and commitment, and then the deep dive, and then also habit reversal has its parts. It sounds very simple, doesn't it? But simple doesn't mean easy. It's kind of like meditation. It sounds very simple when you tell someone just sit and focus on your breath. But try doing that for more than 2 minutes and let's see how easy it is. Patience is absolutely the key. And failure is a part of the process. So failure, when you fail to apply a competing response, or when you apply it but it doesn't work, this is not a sign that the responses are not good or that you don't stand a chance of recovering. This only means that now you have an opportunity to learn more about your problem. Failure is always to be expected in therapy. At the end of the day, change means doing differently. To discover what works, you have to try different things. Some will work some of the time, and then you kind of have to figure out why they work, where they work, and why they don't work in those areas where they don't. Right? So change is best thought of as a marathon, not a sprint. So what happens next, and where do we go from here? Once we complete the habit reversal part, and Maggie has good tools to deal with picking, or rather with the urges to pick, we can proceed to the second step, which is based on acceptance and commitment therapy. In the beginning, we consider Maggie's values and behaviors and how they relate to each other, right? So the values that we have, who we are or who we would like to be, has a lot to do with how we will behave in certain situations. And as we start elaborating on this, it's very easy for Maggie to tell me exactly how BFRBs are preventing her from actually cultivating her values. It takes but a second for her to write a long answer about how BFRBs just ruin everything. And yes, that obviously makes sense. But, like I said, I'm an annoying therapist, so I never really stop there. I'm not interested in how BFRBs are the worst. To put it in simplistic and maybe slightly provocative terms, I'm interested in what is it that they do well, what their job is, and what makes them so efficient and necessary. So let me show you what I mean here. I will give you an example. So Maggie talks about her values, and she elaborates on some of them. She says she wants to be excellent at her job because career is very important for her. She wants to be a great girlfriend. One day she wants to be a great mother. She wants to be a great daughter to her parents. Like, there's a lot of great, good, and amazing. So I ask her to explain what would that mean. So what does it mean to be very good at your job? What does it mean to be a good daughter? Like, how do you know if you are good at those things? And then what she tells me becomes very revealing. She says that essentially, let's put it this way. So being a good daughter means that her parents say that she's being a good daughter. Being good at her job means that her boss will say, "Great job, Maggie. This was excellent." So essentially, how Maggie would see herself would depend on the kind of feedback she gets from other people. If they say you're good, so whew, she's good. If they don't say anything, well, she just presumes she wasn't good. If she wants to be, so good at everything, she will set very high expectations, which is something that we saw, if you remember, when we talked about her resistance. So the way that she resists therapy comes in part from how she sees herself, from who she is. She's someone who always has to be excellent at everything. That means that her expectations cannot be anything but high. And then the second part also turned out to be quite important. Her sort of sense of self-worth is profoundly tied not so much with what she does, but with the kind of feedback that she gets. What does that mean in real life for her? When her boss says, "Would you like to take on this other project?" She has a lot to do already, too much even, but can she say no if her boss's feedback makes her a good or a bad person? Well, not really. Then she has no choice but to say yes, because she wants to be the best employee that she can be. People start relying on her too much because she never says no to anything. "Would you like to come over now?" Yes. "Would you like to do this for me?" Yes. Because she absolutely has to, because her sense of self is tied to the feedback that she gets. And she's terrified that she will get bad feedback and therefore will not see herself in good light. That means that the way Maggie's values are set up kind of makes her feel overwhelmed all the time and tired and exhausted and overworked, because she has to set very high expectations, and at the same time she cannot set any boundaries. This is extremely difficult for a human being to sustain for a very long time. There's a lot of guilt, a lot of anxiety, a lot of tension that goes on with all this, because she's struggling to keep it all together. And so BFRBs come into the story at this point. What they do with their ability to kind of separate her from her emotions is that they allow her to release some of the pressure that these values actually create, right? So if Maggie were to learn to set boundaries in a different way, or maybe to set expectations in a different way, perhaps that would ease some of the pressure. But that requires Maggie to alter her values to a certain extent. And that means that she has a very, very difficult choice to make, which is, will you change at a more profound level? And then consequently also deal with something that causes BFRBs, picking or pulling? Or will you continue this way, and what are the consequences of it? But this is by no means an easy choice to make. Changing our values, or at least the way that we define our values, the way that we go about cultivating our values, is much more difficult than it sounds. It's not a process that's done in 5 minutes, and it's not something that we just intellectually decide to change and then poof, it's changed. So it's at this point that Maggie starts seeing that her problem is maybe more complex than she actually initially thought. And at this point, the instances of resistance that we experienced along the way start making sense on a whole other level. As we proceed with acceptance and commitment therapy, you will see how we deal with these issues. But for now, the best way for you to look at any problem, so hair pulling and skin picking included, is to see them as existing in a context. So BFRBs will arise from your lived experiences, right? And your lived experiences will be shaped by your internal experiences and the world that you live in, and the way that these two interact with each other. So understanding hair pulling or skin picking or any other BFRB means understanding the context in which they take place. It's understanding what their function is. And their function is bad, but it's likely also good. If you think about it, even on a very superficial level, if this is just a bad habit and nothing else, why would something just become a habit if it didn't do anything, right? For something to become a habit, it has to be done repeatedly. And we humans don't tend to repeat random things that do nothing or mean nothing. So for something to even be repeated enough times to become a habit, it has to provide something for us, has to be a resource for something. And that something exists in the context of our lives, and it's very important to elucidate that. We move on with acceptance and commitment strategies, and we introduce 3 different mindfulness strategies, or what people who like acceptance and commitment therapy call mindfulness without meditation. So we introduce diffusion techniques, which allow Maggie to unglue herself from intense emotional experiences and her thoughts. When I say unglue, I don't mean dissociate, cut off, ignore. Just understand that she's not her thoughts, that she's not her feelings, and that she's allowed to act based on what her values say and not what the initial kind of impulsive reaction will have her do. Then we incorporate acceptance and willingness as, let's say, as an overall approach to one's experience, and then obviously present moment awareness. Because I'm also a meditation teacher, I usually advise clients to start a formal mindfulness practice, although not everyone chooses to do that, because I think in the long run, practicing formal sitting mindfulness cultivates certain qualities in us that really make things easier when it comes to dealing with picking and pulling. And I mean specifically better focus, better body awareness, and also equanimity, which kind of allows you to stay centered and not be overwhelmed by any kind of internal turmoil. For me, acceptance is the key to begin changing in any relevant way. We obviously can change without acceptance, but I think it's very hard to change intentionally. So even if you don't try, your experience of the world will evolve simply because you keep living in the world, and we're always reshaped by the new things that happen to us. But if you want to change intentionally, then acceptance is precisely the place to start. A lot of our clients, when they hear the word acceptance, have this immediate reaction, which is, I'm not going to accept picking or pulling. Like, what do you mean accept? It's almost like people think of acceptance as surrender. That doesn't mean that acceptance doesn't mean that you will like what you're doing. It doesn't mean that it will be easier to stop. It just means that you will be able to see your problem clearly as it arises in front of you. And seeing something clearly is really the precondition to changing it. Change without acceptance is kind of like going to a new city and then not having a map or GPS, but having a definitive location that you need to arrive to. Without seeing the road or the path you need to walk, I don't think you can actually easily reach your destination, if at all. And acceptance allows you to do that. It creates a map of the problem in the present moment and in a kind of comprehensive scope of who you are as a person. And that map actually tells you what the way out is. So it's seen clearly that will help you change. Acceptance is by no means surrender. And then slowly, as Maggie learns how to relate to urges and to her thoughts in a different way, we kind of start the final part of the process, step 3, the deep dive. So if you look back at what we discussed, there are basically 2 important psychological topics at play here. One is Maggie's trouble to set boundaries, and then the way that she sets expectations, making them so high that she is more or less guaranteed to fail at a certain point. Even the way she approached therapy was a symptom of both of these. One, she was very reluctant and sort of unhappy and unsure about certain techniques that the program asks her to try. But it was very difficult for her to say, this makes me feel anxious, I don't know if I'm ready to try this, because that would be saying no, and then that would mean that her therapist might think she's not the greatest client in the world. So the way that Maggie would try to kind of avoid certain techniques is by intellectualizing them endlessly and saying things like, yes, but I'm very self-aware, I'm very smart, I'm very introspective, and so on. So basically, what I, as her therapist, was supposed to conclude was that she's just fine if she skips this step. But Maggie herself wouldn't really say this to me, right? So even the way that our therapy was unfolding had to do with her reluctance to set boundaries. And then the way that Maggie formed expectations at the beginning of the treatment was to simply assume that once she starts the treatment, she will magically stop picking, right? Which obviously did not happen and does not happen. And what's interesting about both her boundaries and her expectations is that they're set in a way outside of what you would consider the context in which therapy takes place. So she already knew what failure would be before she even actually started treatment. For example, she could ask, how long do I have to be in the program before I can see some benefits? She could ask, how does this work? Like, what do I do? When do I start implementing certain techniques? But instead, Maggie already arrived and signed up for therapy knowing that anything short of stopping completely as soon as she starts the program is basically failure. So her expectations were not just exceedingly high, they were also created completely outside of the context in which treatment takes place. Once we arrived at stage 3, we set we created a set of steps, or rather set of sessions for Maggie to complete that had to do with boundaries, expectations, defining your strengths, your weaknesses, all these sessions that would allow Maggie to look at herself, not just in this black and white way, but to introduce kind of layers and shades in the whole story. We investigated how does one become a person that has such difficulties setting boundaries? How does one evolve a way of existing in the world where you have to set expectations that are so high? And this is the type of therapy that I think most closely resembles some sort of, how in movies you kind of get on the couch and then talk about your parents. Well, our therapy is done in writing. So you can't talk about your parents, but you can write about your parents. And it's at this stage of the treatment that we usually include that kind of, developmental or psychodynamic perspective. We trace how one's identity evolves, because not setting boundaries, just like picking or pulling, is an adaptive strategy. I always like to look at the human psyche in terms of, if I have this pattern of behavior, what was it good for? Of all the possible patterns of behavior, why would I adopt this one? So, for example, we might trace Maggie's problems with setting boundaries and expectations to her earlier life or her family life or her experiences in relationships and so on. And then what we do here is we try to find different ways of thinking and different ways of framing one's own life story. So this part of the treatment is one that most obviously deviates from the sort of targeted, precise, and structured nature of our program. But in my opinion, this is the most valuable part of the treatment, because this is where you see what the long-term change should be about and what is the general direction in which you should be moving your life. At the same time, this is also a part of the treatment where you make the sharpest cuts, if I may say so. This is the part of the treatment where you learn, how to say no, and sometimes that leads to difficult decisions, and it leads to big changes in terms of how we adjust our work-life balance, in terms of how much emotional investment we're actually willing to provide at work. This again may sound simple when I say it, but if your idea of yourself is as someone who excels at everything, these are very painful and very deep changes. This is why we reserve these kinds of conversations for the end of the program, and then we help our clients set the stage for something that obviously exceeds the scope of an online program such as ours, but something that will give them a lot more in the long run, something that's in a way a developmental task rather than just a simple therapeutic issue to resolve. So to summarize how we structure treatment, habit reversal helps you minimize damage and gain control. Acceptance and commitment therapy teaches you how to befriend your difficult emotions, how to open up to them and see them as a message rather than pressure, how to see them as something to learn from rather than as your enemy. Difficult emotions that we experience arise from the stories we tell ourselves about ourselves and the world around us. And it's these stories that we kind of flesh out throughout our treatment. My work with Maggie, for example, started with her saying, sort of trying to tell me that she's too advanced for certain techniques. And it ended up by revealing a narrative that is starkly different than what she presented initially. It's a person that is terrified of not being good enough. So her story is the story of someone who is terrified of failure, who is terrified of abandonment. And it's these grand narratives that we tell about our lives that are really the key to sustainable change. Those are the things that we should be changing. I don't think it's realistic to expect such dramatic change in what is an online program, but to map it out and to create a path forward, I absolutely think is possible. In fact, any form of therapy that doesn't insist on every client's story being different is, I believe, not a good form of therapy, because humans at the end of the day are not protocols and sequences of sessions. They are people who have their own experiences. So one of the things that I really like about our platform is that we always take those into account. And even more than that, as we learn what works and what doesn't work for our clients, we continually change the way that we approach treatment. So we learn from successes and failures, and we try to improve as time goes by. So you may ask, does that really work, and what are your results? And you'd be right to ask that. So here are some of the results that we have. They are different, as you can see, for skin picking and for hair pulling, even though the approach to therapy is the one that I described. So for skin picking, 81% of our clients experience reduction in symptoms after only 2 sessions. And 91% of our clients experience significant reduction in symptoms after 8 sessions. That would be finishing the habit reversal and acceptance and commitment part, for example. As far as hair pulling goes, 85% of our clients will experience symptom reduction after 3 sessions, and 75% will experience significant symptom reduction after 8 sessions. We have some data, although I didn't present it here yet, that indicates that clients who stay in the program even longer tend to benefit more. But before we have some concrete data, I hesitate to tell you exactly how long. So this is something that we can say with certainty. And over 90% of our overall client base recommends the program. Specifically, it's 91% for skin picking, and 93% of clients who finish Trichstop will also recommend the program to others. I find this to be almost an interesting paradox that Trichstop, which seems to be slightly less effective than Skinpick actually has higher recommendation rates. I don't really know why this is the case, but I would freely guess that it is because I think if clients sort of learn anything throughout this process, which is that they really need patience and they need compassion, or rather self-compassion. And I think a lot of our clients who finish the program, even if they cannot successfully apply everything they learned, they have the skills, they have the knowledge, and then they can sort of work on their own until they achieve the results that they like. So this is my guess as to why more people recommend it than seriously statistically benefit in terms of symptom reduction. So I'm almost done. So if you have any questions, this would be the time to ask. Before we proceed, I would like to tell you that we offer some free resources that are available to everyone. So one would be our self-monitoring apps. You have the Trichstop and the Skinpick app, which you can find in your app store. They're absolutely free. If you have your own therapist and you want to kind of gather data and do habit reversal, this is a really neat and useful little app to use because it will give you all kinds of statistics in terms of how much, what kind of pulling or picking, what times of day, what triggers. So you can learn quite a lot by analyzing these logs that you create. All the data that you record in the app is your own. We don't collect anything. And in fact, we can't even access any of it. It's all stored on your phone, so it's completely anonymous and completely safe. Even when you join the program, the only way for your therapist to see the information is if you give them permission and really just send them the data. So everything that you use the app for is absolutely safe. And then the second free resource that we have are our monthly webinars, which, well, you'll be listening. If you join the webinars, you will be listening to me a lot more. So we have them every month, one for Skinpick, one for Trichstop. Every webinar has a lecture on a topic that our listeners choose. So for example, in May, people who attend the webinar live will be choosing the topic for June. So I gather all the topics that clients or listeners suggest, and then I put them in a poll, and then people vote, and then whatever gets most votes, that's what we talk about. So this was from our last month's webinar. It was about triggers, or rather, why triggers trigger, like why something ever becomes a trigger. So that was what the webinar was about. We have one every month. So if you subscribe to our mailing list, you'll get a notification how to sign up and when. We also upload them to YouTube afterwards. And there's always a Q&A section in the end. And those Q&As usually last longer than the webinar. So if you have any questions or want to learn more or find out something else about skin picking or hair pulling, that's a good place to do that. So you have my contact information here. If you have any questions, if you are interested in working with us, we're always on the lookout, to find new therapists. If you're doing research and you want to collaborate, please, by all means, reach out. If you want to start the program, you can email our support or just sign up and then use the discount code that you have here on the right. So I want to see now if you have any questions, and thank you for being so patient. Okay, so let's see. Should people with both BFRBs do both programs, or will one program help with both? Thank you. One program can help with both. The only thing that I would recommend is that if you start the program, if you remember, I said in the beginning that you have those preliminary questionnaires that you can fill out. So just mention that you struggle with both, and your therapist will take that into account. But both programs are structured in a very similar way. So to be perfectly honest, I don't think you will significantly benefit by completing both. So whichever one you choose is fine if you struggle with both. What hours pay benefits can Skinpick and Trichstop therapists expect? So people that work with us, you choose the amount of hours that you like to work. So we don't expect or insist on you working any specific number of hours. So you determine your own hours. And in terms of hours and pay, you can email our support team and they will be able to give you all the information. Currently, from what I know, about other online platforms that deal with psychotherapy, we pay as much as everyone else does. In some ways, even more, because we have bonuses for therapists. And we also allow something that other platforms don't, and that I think is quite important, which is the therapists can choose who they want to work with or not. Sometimes, as most therapists know, sometimes we just really have difficulties working with certain types of clients, or don't feel comfortable with whatever material there is, or sometimes we don't consider someone to be eligible for a specific type of therapy. Here, it's the therapist who has the last word. So you get to decide who is eligible and who you want to work with. So I think these are some things that maybe separate us from the competition. And an obvious thing would be that would be really good if you had experience with skin picking, hair pulling, because that is our client base, and it's quite important for us to be able to provide the kind of help that clients really struggle to find elsewhere. So inexperienced therapists are less likely to work with us. I want to start the program, but I have a concern not to benefit, as my first language is Arabic. So our program is done in English. In that case, I don't know what your level of English is, but if you're an adult, you should be able to understand every text and all the resources that we offer. To my knowledge, we don't have therapists that speak Arabic. So in that sense, we can't offer specific therapy in Arabic, but the program is done in writing. So that means that basically with every session, you get a text to read, worksheets to fill out, and then you use these worksheets as starting points to converse with the therapist, and then you have an assignment to do. So even if you struggle to understand something in the moment when you're reading, you can always go back. And as you progress through the program, all the materials stay available and open, so you can always go back and refer to something that you think you may not have understood. And I presume, although I don't know, that Google Translate can also help translate the text, for example. Our therapists are there also to clarify if you don't understand anything or you have troubles kind of wrapping your mind around certain concepts. So you will have someone who will be able to help you out every day if you need that. Can you do the program yourself and then be a provider, or is it a conflict of interest? Well, that's a complicated issue, I think, because if that depends, I think, who your therapist was and when you completed the program and whether you're qualified as a therapist. I think it would be maybe not strictly speaking a conflict of interest, but certainly a strange situation that, for example, I was your therapist and then I become your clinical lead. So I think it's a complex issue. And if you're interested in working with us, I suggest that you email me, so not to the support, but to me, and then explain sort of the situation in more details, and I'll be happy to answer. Is there a way to get notified about upcoming webinars? Yes. So go to our website. There's somewhere on the websites, there is a place where you can just type in your email and subscribe to our mailing list. And then once a month, about 2 weeks before the webinar, you will receive an email with, I'm not sure sort of what is that you get on the receiving end, but you will get a link where you can sign up, and you will receive a Zoom link later on where you can connect. And even if you can't attend the webinars, you can simply check out our YouTube channels. They're all uploaded there. I wonder if my insurance company in Germany could cooperate with the program. I'm not, so if by cooperate, you mean whether they would cover the program for you? That depends. So in Germany, I'm not sure about German clients specifically. If you're wondering about Germany, I think our support team could tell you specifically. But we have had insurance companies that would cover the program and then those that wouldn't. It really depends, and there doesn't seem to be any rule, at least not the one that I can come up with. So the best thing for you to do is to contact your insurance provider and see if they would cover the program. We have had insurance companies who would cover it for example, 2 months or 3 months. And then we've also had insurance companies who would cover it for longer than that. So check with them. And then what we can do is issue you an invoice every month, and then they refund the money. So that's typically how it works. You mentioned that therapists can pick their own patients, but what about patients picking a therapist? Are there online profiles of the therapists, and can you switch therapists if necessary? So therapists cannot choose patients. Like you can't say, this is the person I want to work with. But once a patient joins the program, they're assigned to a therapist, and this is done on a random basis. So every therapist allocates a certain amount of hours per week, and then the system allocates therapists based on that. Sometimes we have clients, when the therapist kind of looks at your preliminary questionnaires, they might decide you're not eligible for the program. That's what I meant. In certain cases, we refund the clients. In other cases, we simply reassign them to another therapist. Typically, we don't encourage clients to choose therapists. But what we do is, like, if there's something specific that for example, I've had clients in the past, it happens rarely, but it happened that when they would see that I'm assigned to them, they would say, well, I would feel much more comfortable working with a woman. Do you think you could reassign me? So we do. In situations like that, we do like to, help clients. If you have someone that you specifically want to work with, you can email our support and see if you can have them assigned to you. But be very careful how you go about that. So register for the program, but don't submit the preliminary forms, because as soon as you submit those forms, you will be assigned to someone. So sign up and pay, and then email your username to the support team, and then they will, do something for this in the system, and then have you assigned to that therapist. So that's possible. Also, you can change therapists. That happens very rarely, almost never, but in theory, it is possible. If you really don't click with your therapist, my suggestion before changing them, talk to them about that. Because working through stuff, like, for one thing, your therapist might simply be wrong about something and maybe they need to change their approach. So if you communicate what you need, then they will see whether or not they can meet your needs. But then on the other side, the way that you look at your therapist, that's called transference. So how you see your therapist. This can vary greatly. And it is very likely that there will be a point in the treatment where your therapist will annoy you and when you will just not be able to read their messages. This is normal, and in fact, it's rather strange to finish therapy without at least once being seriously angry at your therapist. So before changing therapists, it's a much more productive way to share how you feel with the therapist. You don't have to worry about hurting your therapist's feelings. If a therapist cannot hear something rough, maybe they need to change careers or go to their own therapy. But so that's not something you should worry about. You should be able to share this. And then if you cannot work it out, then maybe you can request a change. Yeah. Great presentation. Thank you. You're welcome. Will the slides be available on Sked with the others? I didn't really think about that, but I can certainly send them and have them uploaded. No problem for me. If I'm a nail biter, which program is good for me? I would say Skinpick would be your choice. Can you comment on the effectiveness of the Woods and, I will butcher this last name, Toy workbook? Sorry. It seems to use the same techniques, HRT and ACT. Sorry if you mentioned this at the beginning. So I'm not familiar enough with the system to be able to tell you whether or not it works. But what I can tell you from my experience with our program and from the studies that were done, it's that both habit reversal and acceptance and commitment therapy seem to work. I'm fairly skeptical. I don't think it's impossible to change without therapy. But in my experience and in my opinion, it's much better if you find maybe not a therapist, but at least someone who struggles with the issue like you do, and then work through that together. Because even the best of techniques, if they're not applied correctly and reliably and consistently, they're simply not going to work. So maybe find someone to go through the workbook with you. But both HRT and ACT are known to work. When I say known to work, there are studies that show that they work, but unfortunately, when it comes to both, like all BFRBs together, the number of studies is not overwhelming. So, we have to work with what we have. How much does the program cost? I couldn't find it online. Well, if you go to Trichstop, you can find the price, sorry. So the monthly price is $196. And it's subscription based, so it will renew every month until you cancel at some point. You can use the discount that you have here for your first month. How do you access it for slides? So this is maybe a question for someone who knows the technical side of things and how this works better than me. But I can send you the slides if you simply email me. That's easy to attach, so I can send it to anyone. So yeah, you have my email there, and I will send it to you. And I think the recording of this should also be available. Is there research or are there research results concerning Skinpick so that I can tell my insurance in Germany that this program is based on scientific results? So we didn't, I gave you some of the numbers that we have. We have never published our results because it would be kind of unusual for us to test ourselves and then conclude that we're really good. But there are studies for both habit reversal and accept. So every component of the program has been tested and validated. So you can do that. We had a webinar last year. It was either May last year or June, I don't remember correctly. But we had one webinar where I summarized some of the studies that were done on different forms of treatment for skin picking, and also comparing medication versus therapy from the little studies that are available. So I can share those results with you, but our program specifically, we haven't published. I would really love to test the program because the numbers that we have are quite encouraging. And so far we've had over 3,000 clients in total. And I think just the 90% recommendation rate tells you that we do good work, but that requires, I think, someone who is actually a professional researcher. I mean, if there's anyone who wants to test it, by all means, email me. I'd be very happy to get everyone to cooperate with you, because I think we need more studies like that. Okay, let's see if there are any other questions. Okay, that seems to be it from what I can see. Okay, so I would like to thank you all for listening to me for the past 60 minutes. I hope some of this was useful for you. If you're interested in joining our program, you're more than welcome. And if there's anything that you can take away from this, whatever form of treatment that you choose, is by all means be patient and fail, because by failing you learn what's good. For me, that's always a pet peeve of mine when people are afraid of making mistakes, and that's, I think, the fundamentals of change involve making mistakes. So yeah, that would be maybe a good place to finish. So thank you, and I'm looking forward to hearing from you.